Specialist Dr. Anthony Fauci, in a Georgetown University Global Health Initiative webinar, said that the coronavirus is a pandemic of historic proportions. He said it has the potential to be as dangerous as the 1918 Spanish flu. The 1918 Spanish flu claimed the lives of over 50 million people around the world.
Right now, if you look at the magnitude of the 1918 pandemic, where anywhere from 50 to 75 to 100 million people globally died, I mean, that was the mother of all pandemics and truly historic. I hope we don't even approach that with this, but it does have the makings of the possibility of being, approaching that in seriousness. Though I hope that the kinds of interventions that we're going to be and are implementing would not allow that to happen. But it does have strong similarities with that, in that it was the emergence of a brand new infection. That was influenza. This is coronavirus that, essentially thrust itself on the human population and had two characteristics that are the thing that make it, as I say, the perfect storm. And that is a virus that jumps species, but that almost immediately has an extraordinarily capable and efficient way of spreading from human to human, simultaneously with having a considerable degree of morbidity and mortality. And that's what we're facing now. And you asked me to compare it with other outbreaks, and I think I could give you examples of each of those, and I'll do it very quickly, that had one or the other of those characteristics, but not both. And that's what I refer to when I say the perfect storm. So let's take the threat of the bird flu that you and I had a lot of experience when you were in the department. And that is the H5N1 and the H7N9. It jumped from a chicken to a human. It had pre-pandemic potential. But what it didn't do, it didn't spread from human to human. So if you were unlucky enough to get infected, you had a 35, 37, 40% mortality. But it was a dead end mostly with humans. It didn't go from human to human. Then you had the situation with the 2009 H1N1, which was very efficiently transmitted from human to human. But pathogenically, it was a weak virus. I mean, the deaths that year were less than with a seasonal flu. So you had the two ends of the spectrum. One transmitted well, didn't kill. One killed, but didn't transmit well. And what we have now is a virus that is very capable of spreading from human to human. And even though it has a wide range of impact, from 20 to 40% of the people who have no symptoms to individuals who get moderately sick, very sick, serious enough to go to the hospital, serious enough for intensive care, ventilation, and even death. So it's a very unusual virus in that the range of severity is so great and wide, which actually leads to confusion on the part of people as to whether this is really serious as some people say it is. Well, it's not serious for some people, but it's deadly serious for others. So I'll stop there, and that's kind of the overview.
Back in 1918, a new influenza virus emerged, and during this same time period, World War I was taking place. The conditions of World War I, which is overcrowding and global troop movement, helped the 1918 flu spread. The vulnerability of healthy young adults and the lack of vaccines and treatments created a major public health crisis then, and it caused at least 50 million deaths worldwide, including approximately 675,000 in the U.S. Spanish flu hit the world in 3 waves. The first wave was in the spring of 1918. The first detected case was in a military camp in Kansas. Scientists called this infection, which then spread among the troops who were due to fight in the First World War, the Herald Wave, because it announced the arrival of the others. That's why it's called that. The second wave, the second phase of the Spanish flu, occurred in the autumn of 1918. In Spain, there are several theories about how it spread, and some believe it was because the soldiers doing military service returned home in the summer, or that Portuguese people who returned home by train after the war ended were to blame. A mutation of the virus hasn't been ruled out either. Now this time, the number of deaths soared, and in some places, summer festivals increased the contagion, and churches were ordered to stop ringing their bells at funerals so that people didn't panic about how many there were. Now came the third wave. The Spanish flu returned in the early months of 1919, although this time, generally speaking, it was not as lethal as during the second wave, and scientists suspect that the population had by then developed sufficient immunity for the incidence of the virus to have less effect. In countries such as Japan, for example, the flu was to last until 1920, and by the time the illness was over in Spain, 8 million people had died.